Good morning. This was both a very interesting and I guess exciting week from an orthopedic perspective, as well as a little sad too. First, the exciting part. I've been to many orthopedic conferences where there's been absolutely no live blogging or live tweeting from the event, and this week that changed with the help of one particular orthopedist where we were informed of the various techniques available to treat many of the disorders that your shoulder might suffer from. What was lacking, though, is the fact that there was little discussion as to who needs to be fixed, what needs to be fixed, and why it needs to be fixed. Many patients with shoulder pain develop labral tears, which is a cartilage disc in the shoulder, simply as a consequence of aging. Long ago in the 1930s, cadaveric dissections and studies showed that the vast majority of adults over 60 or 70 have tears of the labrum. So, do 60 or 70% of patients have shoulder pain? No. Do 60 or 70% of people need that labrum to be addressed or fixed? No. So do we know who needs to be fixed? No. There's still no evidence out there about many tears in patients over 30 or 40 years old. Rotator cuff topics came up as well. It's amazing how many times I see people in the office and I tell them that I believe their pain is coming from their rotator cuff. And they automatically place the word tear after I give them the words rotator cuff, and they assume the worst. Now, first of all, most shoulder pain is not due to rotator cuff tears, but instead are due to degenerative changes in the rotator cuff. And then the question comes, even if you do have a rotator cuff tear, does it need to be fixed? I've received multiple questions through my website. I have a rotator cuff tear, but no pain, and my surgeon is telling me I need that fixed. What do you think? Now, I cannot offer medical advice through my website, so the disclaimer applies. However, what do you think? If someone has no shoulder pain, a small rotator cuff tear, and yet a surgeon is advising a painful surgery with a long recovery process, and we yet haven't proven that that tear might get larger or won't get larger, do you believe that surgery is necessary? The jury's out. So we really don't know yet who requires rotator cuff surgery, who doesn't, when the timing of that surgery should be, and what process that you need to follow so that we can keep a close eye on you to make sure if you choose not to have a tear fixed, that the tear is not getting larger, and if it does get larger, when we need to intervene in order to possibly prevent it from getting getting larger still. So it was an interesting week. I'm very glad to see that the orthopedic community is engaging on Twitter and other social media platforms. However, I was somewhat dismayed by the fact that there was very little decision-making processing involved. We weren't talking to you about, do you need this, should you need this, why would you need this, and other topics that shared decision-making principles bring about or should bring about in the office every day. So, take-home message, the world of orthopedic surgeons is catching on in social media, and that will be better for you. Another take-home message: is surgery necessary for all things that we find on MRIs? No. Are all MRI abnormal findings actually abnormal? No. Do you need surgery? Maybe. Can you get by without surgery? Probably. But that's between you and your physician, I just implore you to ask a lot of questions, define what evidence they're using to make that decision or suggestion, and truly engage your surgeon. And if they're not willing to engage you and give you a reasonable answer, move on. Have a good day.